All right. Okay, so good morning and hello. I'm Joel Katz, and I'd like to just say a few words before I introduce our first speaker, Dr. Tania Renna. So it is really amazing to see how much progress the TPS has made in 10 years, but it's also, for me anyway, somewhat frightening to know that the 10 years have passed by in what feels to me like the blink of an eye. When we started, we really had no idea what we were getting into. We had no idea where we were going. We had no idea if the TPS would still be around after the first year of funding, which obviously it was. What we did know is that we had a good idea, good sound evidence behind us that intervening early with people who were scheduled for surgery would have benefits in terms of, if not, as Hans said, if not outright prevention, but certainly managing people's pain and allowing them to live a more fruitful life. Okay, what we also know is that the fact that we're here still and have accomplished as much as we have is a testament to Hans's leadership, his energy, his vision, and his compassion when dealing with people who suffer with pain on a daily basis. It's also a testament to teamwork, which has been mentioned throughout this morning's meeting. Collaboration and teamwork, including the many students, residents, fellows, and colleagues, many of whom are here today, who've contributed to helping our patients cope and even to thrive in the face of pain and to lead as fulfilling a life as possible, even if pain persists. And so I'm looking forward to the next 10 years, Hans, and everybody, and we'll see, we'll reconvene here in 10 more years. So, having said that, let me introduce our first speaker. It's truly a pleasure. I've, over the years, gotten to know Dr. Tania Renna. She's an associate professor at the University of Toronto in the Department of Anesthesiology and Pain Medicine. She completed her medical training in anesthesia as a resident and medical training in Ottawa. She went on to complete a chronic pain fellowship at St. Mike's Hospital in Toronto, and she's also had training in spinal cord stimulation, which she received at the Montreal Neurological Institute. She's currently the medical director of the Toronto Academic Pain Medicine Institute, TAPMI, as we all know it by. And TAPMI is the comprehensive interdisciplinary academic pain management program serving as the hub for chronic pain care in Toronto. She practices anesthesiology and chronic pelvic pain at Women's College Hospital, serves as the co-chair of the HQO Guidelines for Chronic Pain, and is currently the co-chair of the Ontario Chronic Pain Network and Ontario representative for Pain Canada. So it gives me great pleasure to ask you to come up, Tania. She'll be talking on TAPMI and the integration of the TPS.
Thank you. Thanks, everybody. Thanks. A lot of people came. It's good. It was awesome. All right, so thanks. Hi, everyone. I'm Tania. He already told you who I am. I know a lot of these faces in the room. So I'll just get to it, try to make it short and sweet. And we'll tell you the story of what's happening in Ontario and at TAPMI. So we'll tell you a little story. Once upon a time, before 2014, we had 14 million villagers in the province of Ontario, and of those 14 million villagers, 1 in 5 have chronic pain, like we all know. So that's, if you total it, 2.8 million Ontarians with chronic pain, and that number is just going to keep going up and up. And so we have to be ready. And the characteristics of these patients when we examine them through a central triage at TAPMI is that they're really our most vulnerable sector. So a lot of unemployed people, a lot of people who live in low-income housing. So we really need to take care of this particular portion of our population. And so we all know the cost, 17 billion direct healthcare dollars. We hear these numbers over and over again. In Ontario, it's $1,700 extra per person. This is data coming from 2015. But also, we can't forget that emotional cost, right? Our patients are more likely to have suicidal ideation or commit complete suicide. So really, that emotional cost is huge. And so data coming from 2015 shows that a chronic pain patient will cost the system $1,742 more than an average patient. And that cost is the same as diabetes, mental health, and hypertension. So pretty expensive when we think about it. And lucky for us, we had a lot of academic princes in our Toronto area, so our fairy tale continues. And you may recognize there's Sir Hanselot in the corner. So a lot of our other guys, Anuj Bhatia and Andrew Smith from CAMH, a lot of guys really interested in coming together to create an even bigger program, so unsilo themselves. But in 2014, we only had a pen and paper and a sword, so we were just doing injections and writing prescriptions. And that's not good enough because the people of the village wanted more. And so we had to give them more because they wanted this biopsychosocial approach. And so they wanted physio and psychological therapies, pharmacy. A lot of our health disciplines from TAPMI are here, or we stole them from the TPS. So thanks, TPS, for generating future workers of the TAPMI program. He's so mad. He's going to be so mad at me. Really, these health disciplines have taught me more about managing pain than med school or anything I could have learned through my own program. So really value the input of the health disciplines in guiding that. And we got lucky in 2014, our ministry gave us some funding. So Ontarians were really lucky when we compare ourselves across Canada to what's happening in other provinces. But the ministry gave us some funding to create these kingdoms. And so we call our little group of kingdoms the Ontario Chronic Pain Network. And so there's 18 university-affiliated pain programs sprinkled throughout Ontario, and they're funded to deliver free health discipline services. And so we at TAPMI are 5 of the programs that came together. And so we make one big program. We have CAMH, Sinai Health Systems, that does musculoskeletal and craniofacial pain. CAMH does a lot of our mental health patient population with heavy, severe mental health overlay. And St. Mike's has our neuromodulation program. They also do some interventions. Women's College Hospital is where we have our fibro program, our pelvic pain group, our transitional age program, where we take kids from who graduate from the Sick Kids program and get them to navigate the adult system. And then we also have a mobile clinic that runs out of there, and now an opioid clinic, so I didn't update the slide to reflect our new opioid prescribing clinic that's run by Karen there. She's in the back. UHN has our SIP program, so the combination program between Toronto Western and the rehab, and it has our transitional pain service. So we're really lucky to have that way back when we started in TAPMI in 2017 or 18. And so we opened the central triage, and we got all these people coming, and we have 7,000 referrals per year. So huge volumes of patients, which allows us to do great studies. And Rachel Bosma is here as our research scientist, and Brittany, they're doing lots of great things with that data, taking a look at who gets referred and trying to see what kind of gaps we can address. Because that's the important thing, is to figure out, hey, how can we cater our program to the gaps that exist in care? And so we really use this chronic disease management framework, which is developed in 2007. But the idea that chronic pain patients shouldn't be coming to the doctor more. They should be learning, we should be teaching them how to have some skills to do some self-management that's supported. But we don't get them to come in for weekly injections, right? We try to get people to learn about their condition and treat it like a chronic disease, like we would diabetes or COPD. And so we use a lot of psychological therapies, so thanks to our psychologist for developing great programs, our ACT program that we have at Women's College, and we have some more coming down the pike. So those are some of our psychological therapies, and our physios, any of our physios here today, or any from TPS we could steal. We do a lot of active physiotherapy, so we don't really touch patients. We teach them how to move again and use their bodies like they should be, because that's what gives us the best results. So we have our physiotherapists that work in groups. We created a Pain University program, which is a 9-week program that involved all of these skills. We don't run it at Women's College anymore. We put it online in the form of modules. So if you want to visit our website, tapmipain.ca, it's there. We sold our program for no money, which is great business, great business acumen, to Self-Management Ontario. So the Champlain Lynn runs the Pain University program virtually, and so we, Kara, one of our nurses, kind of wrote the playbook on how to deliver Pain University, and we gave it to them so they no longer use the Stanford model. They don't have to pay Stanford royalties, and it's homegrown stuff that they're delivering virtually 4 times per month, so they can do it a lot more than we can. And on top of that, they can do it after hours. So they deliver these programs from 6 to 8. So if you go onto this website, you can access the self-management program that we developed between 6 to 8 p.m. And it's offered 4 times per month. So we're really proud of that. We're really proud of the partnerships we made. We partnered with Pain Canada, and Patricia Poulin and Rachel Ayad is here, really highlighting all of our creativity, all of our modules, all of our content, putting it on this poweroverpain.ca website. So really coming together and giving patients kind of a one-stop shop place where they can access a lot of information that we've developed at, Hans has developed at TPS or within TAPMI, and you can find it here. And there's, I hope I got the right QRS code. I know Yad's probably going to kill me if I don't get the right one. But really helping patients have a place where they can go and access the most up-to-date information and our workshops. So if you belong to the OCPN, or Ontario Chronic Pain Network, we try to deliver workshops for the OC for the entire province. So if you're in North Bay, you can watch one of our social workers deliver some content on the internet through this website. And so it's really a good way of us partnering together and trying to deliver care across the province. So that funding we got from the ministry is going further with the help of Power Over Pain. But Power Over Pain is not sustainable unless we get more funding. So TAPMI and TPS have been working together for a while, and we've sent over 700 referrals to the TPS clinic, so thank you so much for seeing that subgroup of patients. And we get referrals from hospitals across the province. And so you can imagine somebody getting surgery in one area shouldn't have to travel to Toronto for TPS services. But that partnership has done great things. It allows patients to get access to our groups, our ACT groups, et cetera. And so it's real collaborative care, and we need to pursue more collaborations, I think. And so, Hans is a lot about partnerships, and so he's done a great job at bringing people like us and ECHO together to really disseminate the knowledge we create at our big program. And so since 2018, we now have tripled the number of TPS services. We have one at Mount Sinai, and then one at Toronto Western, and then one at TGH. So the number of TPS services has increased, and so we're really proud of that. And on top of that, we have multiple TPS services across the Ontario Chronic Pain Network. So there's 7 TPS clinics that are affiliated with the 18 funded programs. So this makes us really proud because patients don't have to travel. If they've had surgery at one center, they can stay within their own center to receive these TPS services. And Anna has been instrumental in kind of creating content for our TAPMI website. So really nice cross-pollination of people working together and sharing their knowledge. We do have a chronic post-surgical pain information on our website. I don't know if you announced this yet, but you did a great job. Hans is doing a great job of of working with Pain Canada to create these patient-facing modules. So there's a set of 3 modules for patients who are about to have surgery, some specific to people who already have chronic or persistent pain, and some people who don't. And so it's a way of giving people skills before surgery on how to ready yourself for surgery and perhaps the pain that exists after the surgery. So really good information that is going to be delivered across Canada. So standardized information, homegrown stuff that you can really rely on, that's evidence informed. And keep doing this great work, Hans. It's awesome, and it's going to change. I'm sorry. Okay, that's good. So this is new. So this is really exciting, and it'll be coming down the pike. And we've all had some input. I think Anna you reviewed this too. A lot of people looking over these to make sure the information's accurate, and it's a product that the TPS can be proud of. And it's really going to change the way people view pain after surgery, because I don't think a lot of these conversations are had in the surgical offices, and this is our role, is to prepare patients for what could happen if they're not prepared mentally with skills, etc. So I think the future of chronic pain management lies in this transitional pain service. Hans has been saying this for a while and been announcing it across the globe. We really have to look at this transitional pain to improve patients' pain trajectory. And I know it's repetitive, but it's really important. And we have an action plan for pain in Canada. Some of us wrote it in the room. Some of our federal government members are here and responsible for rolling this out. And we really appreciate that. But the word prevention is mentioned 14 times in this document. And I think the transitional pain service is what's going to give us that prevention piece. It is a way to get people to change their trajectory. And so the partnerships are really key. The partnerships between the nation, transitional pain services, our own province are key. And I think, if we really want a fairy tale ending, we should think that every hospital across our Canada that's having surgery or has surgical services should have its own embedded TPS program. And that is how we're going to live happily ever after. And that's it. That's my fairy tale. I can go. I'm good. You know where to find me. I'm Women's College. I'll leave you my email address. All right. Thanks, everybody.